Hi, this is Marquita Brown, and today's topic is African Americans and preterm birth. Preterm birth occurs when a baby is born too soon at or before 37 weeks of pregnancy have been completed. In 2018, the rate of preterm birth among African American women was at 14%, which was about 50% higher than the rate of preterm birth among white women at 9%. Virginia's report also looked at racial disparities and found that the preterm birth rate among Black women is 49% higher than other women. Many times we do not know what causes a woman to deliver early, but several known factors may increase the likelihood that a woman could deliver early. Social, personal, and economic characteristics such as teens and women over age 35, Black race, women with low income, pregnancy and medical conditions such as prior preterm birth, infection, carrying more than one baby at a time such as twins, triplets, or more, behaviors such as tobacco use, substance use, and stress. With regard to income, the trend holds up regardless of socioeconomic factors. That means, for example, that a Black woman with a college degree and a comfortable income has a greater chance of giving birth prematurely than a white woman who didn't graduate high school. With infection, the presence or absence of certain bacteria in a woman's cervix and vagina microbiome, which is a community of organisms such as bacteria and viruses that normally inhabit the body, are known to affect the risk of preterm birth. Some bacteria are associated with the significantly higher preterm birth rate among African American women in the United States. For stress, several studies have linked PTSD or post-traumatic stress disorder with a higher risk of preterm birth. African American women have the highest rate of blood pressure in the country, and its onset begins earlier in life, during childbearing years. Due to this reasoning, the U.S. Preventative Services Task Force, for example, recommends the use of low doses of aspirin in patients who have high risk for preeclampsia, which is high blood pressure women can experience during or right after pregnancy that can result in serious complications and sometimes death. Women with gestational high blood pressure or chronic high blood pressure had a higher risk of medically indicated or emergency C-section and spontaneous preterm birth, both at less than 32 and 32 to 36 weeks. Gestational diabetes or diabetes during pregnancy can cause problems for the baby like premature birth and stillbirth. Finally, approximately 44% of infant deaths among non-Hispanic Black infants are related to being born preterm. For more information on this topic, you can contact the National Institutes of Health, Richmond Times-Dispatch, the CDC, March of Dimes, and the University of Washington. This has been your Apple for the Day. Click, like, love, share, follow on Facebook, Instagram, YouTube, and Twitter at Apple for the Day.